Welcome to NSG 412, Study Session 6, Infant Welfare Clinic. Introduction. In this study session, we will discuss Child Health and Infant Welfare Clinic, IWC. In doing so, we will examine the organization, planning, and administration, IWC. Learning outcomes. When you have studied this session, you should be able to 1. Define and use correctly the following terms in bold: Child Health, Infant Welfare Clinic. 2. Outline how to organize and administer Infant Welfare Clinic. 3. Identify the components of the Infant Welfare Clinics. 6.1. Defining child health. Child health is a state of physical, mental, intellectual, social, and emotional well-being, and not merely the absence of disease or infirmity. Child health care focuses on preventing acute and chronic illness while promoting normal growth and development. Hitchcock et al., 2003. Healthy children live in families, environments, and communities that provide them with the opportunity to reach their fullest developmental potential. 6.2. Infant Welfare Clinic. This is a medical facility that specializes in the health and well-being of young babies. It is a department in the hospital or health center where both sick and healthy newborns between 0 to 5 years are cared for. This clinic starts as soon as the child is born. These clinics have different names that are used interchangeably, such as 1. Under 5 clinics, 2. Well baby clinics, 3. Children welfare clinics. 6.3. Organizing and administration of Infant Welfare Clinic. Infant Welfare Clinic is present at the teaching hospitals, state hospitals, and primary health centers. It is usually organized and planned by the hospital management in various health institutions. The clinic is usually administered by nurses, especially community health nurses, public health nurses, community health extension workers, etc. Doctor, usually a pediatrician or family medicine practitioner, is usually present to attend to sick babies. 6.4. Components of an infant welfare clinic. The following activities make up the infant welfare clinic. 1. Registration of newborn babies. 2. Weighing and charting of weight. 3. Interviewing of mothers about their children's feeding, sleeping, and playing pattern. 4. Physical examination of children. 5. Giving of health education. 6. Immunization of babies. 7. Nutritional demonstration. 8. Treatment of minor ailments. Registration. This is the first thing that is done for all newborn babies at the Infant Welfare Clinic. Appointment cards are given to the mothers. This card also contains information that will assist the mother to raise a child well. Weighing and charting. Babies are weighed per clinic. The height, head circumference, upper arm circumference, UAC, etc. are all taken and recorded. All these enable the health workers to know whether the child is growing well or not, and necessary steps are taken. The health workers hold brief private interview with each mother pertaining to her baby's health, and advice or health education is given as necessary. Physical examination. Head-to-toe examination is done for each child to ensure healthy living. Health education. Group and individual health talk is done at the infant welfare clinic. A lot of encouragement is also given to these mothers. Topics that can be discussed at the infant welfare clinic includes importance of breastfeeding, disadvantages of female genital mutilation, family planning, immunization, prevention of home accidents, personal hygiene, food preservation, etc. Immunization. Babies are immunized against the killer diseases. These include tuberculosis, poliomyelitis, tetanus, diphtheria, whooping cough, etc. Nutritional demonstration. Preparations of some local but nutritious food is done for mothers, especially on food that can be given to malnourished children and foods that can serve as weaning diets. Treatment of minor ailments. Minor ailments are treated while others are referred to pediatricians in the hospital or through a two-way referral system. Study session summary. In this study session, we define child health and examined infant welfare clinic as well as organization, planning, and administration of infant welfare clinic. End of study session 6.